Late Night Health continues. In the next half hour, we're going to spend some time with Michelle Chafee. We talked to her about 6 weeks ago. She's a patient advocate. Went into her own doc. Doc said, you're fine. And then a couple weeks later, she gets a report back. She had ovarian cancer. So she is now a patient advocate, and we're going to get an update from her today. And then we'll wrap up today's show with Robert Clancy, the author of The Hitchhiker's Guide to the Soul, as he talks to us about honesty. That'll happen this hour on Late Night Health. Right now we go to Virginia, and we're going to spend some time with Dr. Zach Bush. Dr. Bush, or Dr. Zach, as I'm sure a lot of people call him, is kind of interesting because he's triple board certified. Internal medicine, endocrinology, and hospice palliative care. Dr. Bush, welcome to Late Night Health.
Thank you so much for having me on.
Your training is allopathic, traditional health. Do you still practice traditional health, or have you come over to the light side and are practicing forms of alternative health or even integrative medicine, combining the two?
Yeah, it's been a non-linear path for me. I am definitely practicing an integrative philosophy now of medicine, and understanding that all of the 17 years of education that I got were really geared towards disease management, which is interesting from a scientific standpoint, but it turns out to be profoundly uninteresting from a patient standpoint when you're receiving care under a disease management methodology. It can be quite frustrating and feel like nobody's really getting at the root cause of your problem. And after 8 years of practicing, by 2010, I was starting to see as a practitioner it's quite unrewarding to practice that disease management approach, as it was leaving my patients in a downward spiral of health. And so it's been a really nice journey to start to lay some founding pieces to my worldview of how health happens and how disease is nothing more than a shortage of health.
Ooh, that's an interesting... disease is nothing but a shortage of health. I like that. When a patient comes in to see you, doctor, how long is a typical visit with you? Is it more than 3 or 4 minutes?
Yeah, it's been an interesting journey there as well. It now takes me an hour and a half just to get through an initial visit with a patient, and the main change has been that I spend a lot of time listening. And the previous model that I was working under in the university setting was not allowing much time for listening. And to have an hour and a half to listen to somebody's story, you get an amazing amount of information, and you always get all the answers, it turns out. And in fairness, I was actually taught that in medical school. I was told early on that the patient will always tell you the answer to their problems, usually in the first couple minutes of the visit. But then we get so convinced of our own knowledge, and we get so sidetracked by all of the allopathic methodologies and treatment plans and everything else that we get sidetracked from the patient's story. And so this is really a journey instead to understanding where we're headed as a listening group, as physicians more than anything else.
Doctors listening, boy, that's somewhat unusual.
I hope it's becoming more and more common.
Yeah, absolutely. We've in looking at overall healthcare last week, prepping to talk to you today, I took a look at the current listing of where American healthcare is. We are number one in terms of how much it costs, and we are number 37 in terms of quality. Any comments on that?
37 would be a pretty good ranking. I've seen numbers as low as 49th in the world for health outcomes, and so, but regardless of how you cut it, whether we're the 37th or 49th, we are in a dismal state. We are spending not only the most, we're spending more than twofold as much as the next most expensive country, which is usually Japan or Northern Europe, Northern European countries. So We are extremely expensive. We're spending somewhere around $8,000 per capita per person per year in healthcare. That's every man, woman, and child costing us $8,000 a year in healthcare expenses. The burden of disease that's driving that is more stunning than the actual cost, I think. We are now looking at 49% of American adults being diagnosed with cancer before they die. That's 1 in 2. 1 in 2 people with cancer is a stunning number. Our rates of autism have changed from 1 in 10,000 in 1970 to 1 in 42 now in our children, and so we are on target to hit 1 in 3 children with autism at our current rate of growth, that epidemic, by year 2030. So when you start to look at those numbers in the adult population of cancer or heart disease or dementia, or in the child population with autism, asthma, food sensitivities, and then across the spectrum of adults and children, the rates of obesity, the burden is so heavy that it's really making a financially feasible future for our country completely unrealistic.
Before we segue and talk about gut health, because I think that's we've talked about gut health being where it all begins. All disease and health begins in the gut. We'll talk about leaky brain, leaky gut, and even dirt, right? And you have a product called Restore that I want to talk about as well. I'm curious, though, if you had seen the article of a few years ago from I think it was the New York Times. It could have been New Yorker. I'm not sure. Where they did a study, and $2 for a generic Tylenol. Do you find that reprehensible?
Yeah, and, it's easy to see conspiracy theories. It's easy to see, ethical dilemmas, but in some ways we're just looking at human nature. We've built a system that is built around fulfilling board members' expectations on profit margins, and that pharmaceutical companies, hospital systems, physician offices, from the bottom to the top, our system is really made to appease and reward those that are investing money rather than receiving health care. So that's how those numbers get so skewed, and it's just normal human nature that there's humans out there trying to do a good job of making a company profitable for their shareholders. And so as malignant as it might sound, I think that in some ways it's just humans trying to do a good job. It's just that we made the target the wrong thing. And
what should have the target been?
I think the target really has to start to look at human health rather than disease, and it certainly needs to shift from a monetary reward system to one of health outcomes. We need to recognize that the only way for financial solvency as a nation is to be healthy. If we are an unhealthy nation, we are destroying our own solvency as a nation from a financial standpoint.
You mentioned allergies, asthma, autism, and the rates are growing. If we take care of our gut health, do you think a lot of these situations could go away, according to your studies and research?
Not only our studies here at Biomic Sciences, but also just across universities across the world. Every single disease process now is starting to have articles in peer-reviewed journal Science coming out demonstrating that the pattern of bacteria in the gut is predicting the disease outcomes in the individual. That sounded like just ridiculous speculation when they first started happening in 2005, but now, 10 years later, it's sounding like gospel, and everybody in every field of medicine is now turning their attention to not the human biome, but the bacterial biome and what's going on in the bacteria. And 2 million genes there versus 25,000 genes in the human. So huge burden of potential out there.
So the bacteria will take over and rule the earth one day.
Yeah, whether we're here or not, they're going to be around, and they're going to take care of the place. They are definitely the gatekeepers and the cleanup crew for a planet and a human being at once. And so the same bacteria that we would dump into Fukushima, we're putting Pseudomonas bacteria and other things to clean up that radioactive mess. Those same Pseudomonas bacteria can live in the human gut and help detoxify even radioactive material in our gut. So bacteria really are the front line of defense and the cleanup crew. And we need to start to respect them.
You've created something called Restore that we're going to talk about, and we'll tell people how to get it. We'll send them over to your website and also to the Late Night Health website. But, you go to a supermarket today, and they've got wipes to wipe down the handlebar. They've got, hand sanitizers. Are these things good or bad, in your opinion? Or should we just let the dirt, get on our hands, and it won't hurt us? It'll actually help us.
Yeah, and it turns out that we extrapolated findings in the surgical environment. So we found out, in the early 1900s that surgical outcomes were improved if surgeons would wash their hands. They were not wearing gloves at the time. They were just working with their hands.
Right.
And they found out that they were passing disease. Well, we took that information from the operating room and have, over the last 100 years, extrapolated it to everything, including the grocery stores you speak of. And so we instead of just seeing, a controlled environment like an operating room, the importance of clean hands, we started to develop the belief in sterility, and that sterile was.
And
really
we're going to take a look at that when we come back. Our guest is Dr. Zach Bush. We're talking about gut health. We're going to talk about his upcoming book, Gut Bomb. Hopefully, we'll be one of the first to talk about that. Visit us at latenighthealth.com. latenighthealth.com. More coming up.
Late Night Health continues in a moment.